Hey folks, emergency rooms around the country are really busy again, particularly in Quebec. So what's going on here? So think of it as a supply and demand problem. On the supply side, you just don't have enough doctors and nurses because we lost a lot of folks during the pandemic and a lot of folks haven't come back. It takes time to train people. And then on the demand side, you have an aging population, people living longer, having more chronic diseases. You have a growing population with immigration. And so you have more demands on the healthcare system. And then at this time of year, you get this imbalance because people get respiratory viruses. We are seeing a lot of COVID. We know it from the wastewater data. We know it from hospitalization data. We're not yet seeing a lot of flu and RSV, but that's coming. So already we have this capacity issue in some parts of the country, and that will only get worse in the months to come, particularly with kids being back to school. And that's where they exchange viruses, and that's one of the reasons we see this explosion in viruses at this time of year. So we talk about this every year at this time, and there's outrage about people in hallways and people not having access to emergency rooms, and sometimes people dying because they were turned away from an emergency rooms closing. And there's a lot of hand-wringing about it, and then nothing really gets fixed, and we talk about it again the next year and the next year and the next year. And so what are the solutions here? Well, the solutions aren't easy, and that's why the problem hasn't been fixed. The solutions require long-term thinking, long-term investment, things that many provincial governments are not able to do or don't have the desire to do in a 4-year election cycle. The Canadian Medical Association has suggested some solutions that are shorter term and some are longer term. So how do you fix the supply side? Well, maybe you accelerate licensure for doctors, nurses that come from other parts of the world. You do that in a safe way, but you can increase capacity that way. Maybe you take down barriers to doctors moving between provinces so that when you have holes in some provinces, they can be filled by doctors from other provinces. You invest in long-term care. A lot of the reasons people can't go from the emergency room to the hospital bed is that those hospital beds are occupied by people who need a long-term care bed or a long-term rehab bed. So we need to invest in that part of the healthcare system. And then you need to just invest in primary care, because if you have a family doctor, that's where you'll go instead of the emergency room. And you'll also get that preventative care that'll prevent you from having the event that made you need that emergency room visit. So at the end of the day, the solutions are not easy. But we need to keep hammering away at our governments to make these long-term investments, or else this problem will just get worse every year.